Tegaderm I.V. Advanced Securement Dressing, 1683, Application Technique. Let's begin a peripheral catheter dressing application using the Tegaderm I.V. Advanced Securement Dressing. The application technique that will be demonstrated has been tested to offer the best catheter stabilization for this dressing. Using aseptic technique, open the package or IV start kit. Until you are ready to apply the dressing, the packaging can serve as a sterile field for the dressing. Prep the catheter site as dictated by your facility's protocol. Prep the entire surface where the dressing will be applied, not just the insertion site. Let all prep solutions dry completely to increase antimicrobial activity, enhance the adhesion of the dressing, and reduce the potential for skin reactions. Clipping excessive hair at the site will remove dressing adhesion. Shaving is not recommended. As you can see, the Tegaderm I.V. Advanced Securement Dressing was designed with securement in mind. It's a transparent film which has a stabilization border, a deep notch to secure around the catheter hub, securement tape strips, and a pattern-coated adhesive technology. For application, it is helpful to think about the dressing with the top portion being the head and neck of the dressing, and the notched end as the fingers of the dressing. Starting at the head, tape strip end of the dressing, remove the back liner as shown. This will expose the adhesive surface. Using one hand to stabilize the catheter, hold the dressing in your other hand with the adhesive side facing the skin. This is a large non-adhesive area on the tape strip end of the dressing to accommodate your gloved hand. Bend slightly with your thumb. The clear portion of the dressing should be over the insertion site, and the notch end, fingers of dressing, should be pointing distally towards the patient's fingers. Do not hold the dressing with two hands on the stabilization border. Holding the dressing in this position puts your gloved fingers in contact with the dressing's adhesive, which could remove some adhesive. To optimize dressing adhesion, hold the dressing by the non-adhesive area located on the tape strip end of the dressing. Holding the dressing in this position allows for an aseptic, no-touch application technique and provides maximum control without touching the dressing adhesive. Position the deep portion of the notch in the middle of the colored portion of the catheter hub. For catheters with a push tab, the deep portion of the notch will align up against the push tab. Pinch in place around the catheter hub. Then apply firm pressure over the film and distal or head portion of the dressing to establish good adhesion to the catheter hub and skin. Notice how the notch ends or fingers of the dressing are slightly raised after this step. This allows you to wrap the notch ends or fingers of the dressing beneath the catheter hub, overlapping slightly if possible. This step provides a cushion for the catheter hub so it does not rest directly on the patient's skin. Next, apply firm pressure over the entire dressing and frame to ensure optimal adhesion to the skin. The adhesive technology found in the Tegaderm I.V. Advanced Securement Dressings will continue to build strength over the first 24 hours of initial placement. That firm pressure you apply is important in achieving this effect. Make sure all surfaces of the dressing are pressed down onto the skin. Applying firm pressure allows the dressing and edges to conform to the skin and maximizes the adhesion of the dressing to the skin's surface. A good explanation of the pressure-sensitive adhesives used in this dressing is illustrated by this tape demonstration. Apply a piece of 3M tape to a surface such as a table. Apply pressure in a few spots on the tape surface. Now remove the tape and notice where you applied the pressure. The tape is adhered much better where you applied the pressure. In the same way, applying pressure to the dressing with application will result in better adhesion and conformity to the skin surface. Once the dressing is firmly adhered to the skin surface, slowly peel back the frame of the dressing while sealing down the dressing edge. This prevents the dressing's edge from lifting up off the skin when getting caught on the patient's bed linens. You can see that there is no stabilization border on the lower edge of the dressing. This makes it easier for the clinician to observe the condition of the vein beyond the insertion site. 2 pieces of securement tape strips are included with this dressing located on the paper frame or carrier. Remove pre-cut securement tape strips from the paper frame. Apply each strip as shown in this photo. Apply the securement tape strips parallel and adjacent to each other over the catheter hub, covering the exposed push tab and luer lock connection, and continue straight out across the dressing. The securement tape strips should be applied over the catheter hub and luer lock connector, not under. Pinch securement tape strips around catheter hub and luer lock connection to ensure good adhesive contact around the sides. Do not tent the tape strips. Do not use the dressing securement tape strips to secure the J-loop of the extension set. These are intended to be a part of the dressing securement system. Use additional tape from stock or the IV start kit to secure the J-loop. 3M's test results indicate that this new taping technique offered optimal securement results for the Tegaderm I.V. Advanced Securement Dressing. Apply the documentation label. The last step is to apply firm pressure to the entire dressing to ensure optimal adhesion of the Tegaderm I.V. Advanced Securement Dressing to the skin surface. Removal technique. For ease of dressing removal, remove securement tape strips first. Then separate the edges of the notch or the dressing's fingers from under the catheter. While stabilizing the catheter, remove the dressing toward the insertion site using the low and slow technique demonstrated here.